Hello, it's Dr. Brandon Pettke with Curis Functional Health. Tiffany is going to help me go over 3 things that we're going to give you in case you're dealing with neck pain, upper back pain, some things that you can do at home to help you relieve the pain. So very first and foremost is right here behind me, I have an ice pack, all right? So if you have pain, what has happened is it has been flared up and there's inflammation going on, and the biggest thing that we want to do is bring down that inflammation. So an ice pack, not a heat pack, that's your best bet. You don't have an ice pack like this one here, then you can make your own. This one's pretty cold, so I'm not going to hold on too terribly long, but you can make your own with a Ziploc baggie. But you want to use the ice on the area for 20 minutes once every hour. So 20 minutes on, 40 minutes off, 20 minutes on, 40 minutes off. That's how you want to utilize that. So ice pack is the number one thing. The second thing, that's where Tiffany comes in to play, is we're gonna show you, I'm gonna grab this chair over here and she's gonna sit down and demonstrate. There's gonna be 4 stretches that we're gonna do if you wanna have a seat. So the very first one we're gonna do is she's gonna scoot up in the edge of the chair, okay? And then what's best is if she grabs underneath the chair with one arm, and then she's going to pull her head straight to the side. So she's gonna take her ear straight over to the shoulder. It's gonna stretch this muscle right here called the trapezius muscle. And what you're gonna do is you're gonna hold that there for 30 seconds, all right? So you're gonna stretch this out for 30 seconds. Then after 30 seconds, she would go over to the other side. She would pull it the opposite direction. Same thing, 30 seconds on this side. And you don't have to crank down, just give a nice stretch to it to relax down those muscles. You'll do that 3 times per side, okay? That's the first stretch. The next one you're going to do, it's gonna be similar. She's gonna grab underneath the chair, then she's gonna take her head, she's gonna bring it at about a 45-degree angle, kind of at an angle like that, and she's gonna pull that down. And what that's gonna do is stretch a muscle right here called the levator scap muscle. It goes right into the corner of your shoulder blade, your scapula. And so you do the same thing, hold that for 30 seconds, then you would switch hands. She would bring it, you can kind of see now the angle of the camera, she's gonna bring it at 45 degrees like that, stretching the one on the right. There, same thing, 30 seconds. You do each side 3 times. So 1, 2, 3, 4, 5, 6, like that, okay? The next one, what we're gonna do is the barrel stretch. So she's gonna be sitting right there, and it's basically kind of like you're wrapping around a barrel, but she's gonna expand her elbows out, and she's stretching the muscles on the back between the shoulder blades. She's stretching those out, holding it there for 30 seconds. Then she would relax. She would do it again for 30 seconds, relax, do it again for 30 seconds. Kind of see a theme here, right? And then the next thing we're gonna do, we're gonna actually go over to this doorway over here, so follow us over here. So the next one is we're going to do a Peck Stretch. So we'll have her, let's actually have you stand here and face towards the camera. There you go, like that. So her arm is gonna be parallel to the ground, okay? She doesn't wanna have her arm up like that or have her arm way down like that. It's gonna be straight right there. And she also, see how she has it on the edge? She doesn't have her arm, here, scoot in so they can see that. You don't wanna have it like, well, nobody does it that far in, but anyway, so you wanna have it out to the, you don't wanna have it like that. You wanna have it just like she does right there. And then what you're gonna do is with your foot closest to the door, you're gonna step forward, you'll feel the stretch, and then to get a little bit extra stretch, you're gonna rotate out like that. So she can really feel it through there, tight through there. Yeah. All right. So anyway, so you're gonna hold that for 30 seconds. You'll feel it right through the pec because most people, their heads are forward and they're tight through here. So we wanna bring that back. So you hold that for 30 seconds, then you would turn around 30 seconds. Guess what? You're gonna do it 3 times on each side, okay? The last thing, so that's step number 2. So you got the ice pack, then you have the 4 stretches, and then the last thing that we're gonna do is we're gonna show you something that you can do. We use a lacrosse ball here in the clinic. So these bounce, they get a little bit of give. Baseball's too hard, a golf ball's probably too hard, tennis ball, maybe a racquetball aren't quite as hard as this, but we're gonna use this to key in on some key trigger points. Can you stand here and then I'm gonna show the muscles to you, so you turn around to the camera. So there's two main areas that you're gonna work. So one is right where the levator scap, which we talked about, that muscle earlier. You're gonna right there and right there, because those muscles come up all the way to the base of the skull. And then there's gonna be some muscles right in between your shoulder blade that we're gonna target. So what she's gonna do is she's gonna lay, I'm gonna give that to you. She's gonna lay down on the ground. All right, so you wanna have a harder surface, and she's gonna place it right underneath her shoulder blade. Is that about right in the spot? Is it tender for you?
Yep.
So what you're gonna do is you are going to lay on it. At first, you're not gonna move around, okay? You're just gonna lay on it for about 20, 30 seconds. And what's gonna happen is the muscle's real tight and it's gonna start to give way and start to relax down. Then after you've laid on it for about 20 or 30 seconds, then you're just gonna roll around on it just a little bit, okay? So it doesn't take much movement. You'll feel it, it'll probably be tender. So you do that for about 30, 45 seconds, loosen up the muscle. Then what you will do is we won't have her do this, but then you'd switch it over to the other side where I pointed to on the other shoulder blade. And then after you did that same process where you lay on it just still for about 30, 45 seconds and let it relax down and then rub it around, then you're gonna go down between the shoulder blades, do the right side and then the left side, and you'll repeat that same process. All right, so I'll give you a hand up. 1, 2, 3, come on up. So anyway, so those are 3 things that you can do at home if you're dealing with neck or upper back pain. They'll give you some relief if you're caught in a bind. If it continues going on, I always tell patients for 3 to 5 days and you haven't seen relief or you're not getting rid of the pain, then give our office a call and we'll get you worked in and we'll get you evaluated. We can obviously do some more things here in the clinic that are a little bit more effective. So anyway, hopefully that was useful. Have a wonderful day. Take care.